ready. Chris, you have 20 minutes. From the 20 minutes, we suggest 10 minutes for the presentation, 10 minutes for the Q&A session. 2 minutes before the end of your slot, we'll let you know that the time is running out. And if anyone would like to connect with Chris, please let me know in the chat and I will facilitate the contact. If you have your presentation ready, Chris, I believe we can start.
Okay. Thank you very much for the introduction. My name is Chris Parch and I'm here to talk about Sanocann. We are a Maltese company with a background in the pharmaceutical industry, actually, where we have experience in business development, distribution, marketing, and retail, not only in Malta, but in certain countries in North Africa, Southern Africa, and also the Middle East markets. Today, I'm not here to speak about any particular portfolio or products in particular, but more about an industry which our group has decided to invest in, which we are very excited about, and which we are looking for distribution partners to help us represent our principal companies, not only in Europe, but in other selected territories around the world. So I'll just upload my presentation, if you bear with me.
Yes, it's coming up.
Visible?
Yes, very good.
Okay, so a little bit about the industry. The global legal cannabis industry is expected to boom to over $100 billion by 2024. And as you can see from this slide, the largest market is expected to be Europe by that time. Today, as we know, it's North America and Canada which are taking the lead, but we are expecting the growth now to come mainly in Europe, and that is the markets we're going to be focusing on today. So if I look at the European legal cannabis markets in particular, as I said, this is worth over 30 to 39 billion expected in 2024. Of this, we can see that 16.8 billion is expected to be from the recreational cannabis business and 22.3 billion from the medical cannabis industry, which is what we are focusing on today. From a legal perspective, of course, there's a lot of connotations linked with cannabis and what is used for on a recreational level illegally. But we have seen a very progressive approach now by most countries in Europe towards the acceptance of this product for a medical cannabis purpose. And as you can see from the map, most markets in Europe are now seeing this industry in a progressive way. There are others which are holding back a little bit because there is no distinction between narcotic and non-narcotic products. But this is changing, and especially we saw just a couple of days ago on 19th November, a top EU court has ruled that CBD is not a narcotic drug. CBD doesn't appear to have any harmful effect on human health, the judge was quoted, and the court observes that the provision on the free movement of goods within the European Union are applicable, since the CBD at issue in the main proceedings cannot be regarded as a narcotic drug. So this is a very important sentence, and this is bound to have a very positive effect on the growth of the industry in the coming years. So I'm talking about CBD and a little bit of a background to this. So there are two main types of cannabis plants. One of them is hemp and one of them is marijuana. The hemp plant being very CBD strong and less THC, and the marijuana plant the exact opposite with a less component of CBD and a much higher component of THC. And for those of you who are not familiar what these CBD and THC components mean, these are both cannabis plant compounds, with the CBD in layman's term being the non-narcotic compound and the THC being the narcotic compound. So CBD is a non-psychoactive cannabis plant compound. It has calming, relaxing, and effects, and it also supports well-being. Whereas the THC is a psychoactive plant compound. It stimulates appetite, euphoria, and drowsiness. So what are the medical indications for these? We're hearing more and more about these products in the news, but what do they actually get indicated for? So on the CBD side, which I remind you is the non-narcotic side of the plant, we have it is indicated for anxiety, depression, inflammation, inflammatory bowel disease, migraines, nausea, pain, etc. On the THC side, it's more anxiety, glaucoma, insomnia, low appetite, muscle spasticity, and nausea and pain. Okay, so these ingredients can then be given in different forms of finished product. On the CBD side, they can be presented in oils, vapes, certain medicines, even food and drink, edibles, coffee, beer. You can have it in, you see it now in lots of different kinds of food, skincare treatment, beauty products, and even in pet food now, you see very commonly lots of products with CBD derivatives. On the THC side, and I remind you once again, this is the narcotic product. You find this in syrups, oils, drops, and medicines and topicals. The most important thing is that these have to be controlled products. These are not products that you will find over the counter like you would do for CBD products. Okay, so here on this slide, I've put together examples of the kind of industries we now typically find CBD products in, and it's basically everywhere. It's in edibles, it's in our chocolates, sweets. It's, as you see, I mentioned before, veterinary products. There are lots of products for pets as calming agents, etc. We even find it in beverages. It's used for sports indications, cosmetics. So it's everywhere, and it's not a surprise where you find big international beverage companies investing heavily into this industry now, because these products are all going to be available in their portfolio in the coming years. On the THC side, these are a different kind of product. So here we take the more pharma approach. These are products which have to be registered through the Ministry of Health authorities of the various countries as pharmaceuticals. But not only are they pharmaceuticals, but they are narcotics. So they need to be regulated as normal narcotic products such as morphine, etc., fentanyl, and are completely controlled. So in terms of distribution channels, because of the pure nature of these products, one of them being non-narcotic and the other being narcotic, the distribution channels are obviously different. On the CBD side, you will find many products available in supermarkets, in normal drugstores, in beverage shops, and they can be prescribed by doctors by prescription as well. But they could, as I said, be found on an OTC basis as well. You can go online and order online in certain markets according to the local legislation of that particular country. And the normal distribution network then is typically through normal distribution to retail outlets. And for these kind of products, you don't have to have a pharmaceutical grade distributor. For the THC products, of course, you do. These are prescription only medications, controlled narcotics, which can only be imported and distributed through licensed pharmaceutical distributors. And of course, narcotic regulations apply. Some of the companies that we are representing already, I have on the screen. So MGC Pharma is a leading company which is focused on the pharma-grade side of the business. So they are registering their products with the European medical authorities. to get a marketing authorization, which they will then be selling through the narcotic levels, like other narcotic products. We have Dragonfly, which is a leading UK company. They're already selling their brand through prestigious retail outlets such as Harrods, such as Boots, Superdrug, etc. Freya is a Slovenian company with a very interesting range of CBD forms and delivery systems as well. And Can Prisma is a Portuguese company actually focusing on flowers, which is a different delivery system, of course, for the CBD. Okay, so I mentioned a little bit about our background at the beginning of the presentation. We are now involved in 2 or 3 different models as Sanocann. The first is an online platform that we have developed, so that's now online, Sanocann.com, where we the objective is to have a whole spectrum of CBD products, everything from sports products to cosmetic to the very common oil products and even pet products. Those are available online. We already represent the companies I mentioned on the previous slide, apart from the MCG Pharma, which obviously, because they are THC based, cannot be online. So basically, this is like a normal online shop where the customer can go in, they can select products from different suppliers and have them delivered to them in one shopping basket. So we are always looking to add more suppliers to this online shop. The second is white and private label. So we are representing our suppliers also, not only online, but also trying to get business opportunities, offering their products for white label to third-party customers from the markets that have been granted to us. And the final model is distribution network. So not only are we selling online, but we are also distributing and building up a distribution network so that we actually can physically move the stock through local distribution companies in our target markets to be able to get the products actually on the shelves in that market. And really, that is the main reason why we're here today, because we're reaching out to high quality distributors such as yourselves to gather interest to join our network of distributors, so we can make our customers' brands reach their target markets. Okay, so in that regard, this is my last slide. These are our contact details. So for any business inquiries related to the slides I presented, we can be reached on this email address, and that's my direct telephone number. So on that slide, I conclude my presentation, and I'm happy to take any questions.
Thanks a lot, Chris. Very interesting presentation, and let me follow up already with the first question. Obviously, CBD is very fascinating industry, and everything around it has a big potential, business-wise and also health-wise. And my question is, when do you think is the time? Because I think a lot of people are deciding whether to jump on it or still wait for a bit, because they obviously see the potential, but then they never know if the time is right or when the time is right to jump on it, because the potential is definitely there. You think that the time already has come when the CBD business already is here to start it, and the boost of it, that people can benefit from it?
Yeah, I mean, I think that personally, if you look at the experience of other markets as well, we are in Europe, we are not the first markets to take off. We've seen the boom on the other side of the Atlantic, But certainly we are now about to take off here in Europe as well, as legislation allows us to operate, especially in the CBD products. It's never it is always a good time to jump on now, but how long this boom is going to go on for, and whether there will be room for late entrants, time will tell. I think early investors will always benefit the best, but this is a learning curve as well. They say that anyone that's been in the industry for 6 months is a veteran, and so the local authorities are still legislating, trying to see what best way to allow this industry to expand and grow. But everyone has accepted that it is happening, and it will happen. We have decided as a company to jump on the bandwagon from now, to prepare the platform. But I'm sure even our own strategies and directions will have to change and be adapted constantly as we keep an eye on legislation and changes in regulations.
Okay, thanks a lot.
Thank you.
Hello, Chris. To follow up on this, actually, on your answer, I want to ask you what business model works for you the best? For example, I like eShop, or if like B2C is the best way through pharmacies or etc.
For us, look, we are at the beginning of our journey. So, I mean, it's a two-pronged approach for us. We think there are certainly online business is a convenient way of purchasing for the customer, and there will be a certain volume of sales which will go through that. But we are looking at developing a strong distribution network, because we also expect a high volume of business to go through traditional distribution models, and to see the products on the shelves. You will see more and more products in supermarkets, in pharmacies, in different types of outlets which have CBD derivatives in them, and they need to be supplied not online but through the distribution network. So that's a very important part of our model.
Thank you.
And maybe one question, hi, from me. I would like to ask you if you know who is your end consumer. Who is the end consumer of it? Because the target market, I think it's really huge, but in reality, who is it?
As I said, I'm talking about today not a range of particular products, but about industry. And as I showed in my slides, we are looking at a number of different industries. So there's a customer base in the sports industry. There's a customer base in the food industry. There's a customer base in the veterinary industry. So it varies. Then there is the individual person who wants to stay at home and have the CBD oils for his own wellness. So there are multiple industries which can be tackled. It's a multiple prong strategy.
Hi, Anne-Marie from Denmark. Hi, thank you for your presentation. I just wanted to ask you, what about the registration of the products? What are they registered as? Medical device, consumers? What?
Yeah, this is a very good question. And again, legislation is changing all of the time. Of course, I'll put the THC products aside, because as I said, those will be a pharmaceutical-based registration. At the moment, a lot of CBD products are classified under novel food status. It depends on the percentage of CBD that is in the product, but at the moment it's novel food status. Does that answer your question? Sorry.
Yes, it did. I was on mute. Yes, thank you.
All right, maybe a couple of last questions. We have 2 minutes left.
Okay, one more question from me, actually. What would you say is the main body and agency to get the information, like the legal information from? Because, for example, from my experience, we've had some pretty big obstacles on the way researching this topic regarding the CEE market, for example. So what do you think is the current situation on the market CEE wise, and also like European regulation wise, please?
I think that every first of all, when you have court sentences like we saw, as I mentioned a couple of days ago, that certainly helps, and it will help to shape the local legislations as well. But it is, in our experience, the local health authorities which will have the final say, and which will determine whether a product is allowed to be imported under a certain characteristic or not. I mean, speaking from our own experience here in Malta, when some of the brands that we represent until recently were classified as food supplements in the UK, and you could go into Holland and Barrett or any similar retail outlets and take it off the shelf. Here in Malta, all cannabis-based products were put in the same basket and were regulated in the same way, which didn't make sense that a THC product is being seen in the same way as a CBD oil. That is changing, but as I said, things are changing on a daily basis, so we have to wait to see.
Okay, thanks a lot, Chris.
Okay.
Pleasure to have you. Once again, if anyone would like to get in touch with Chris, please send me a message in the chat, and I'll put you through.